Good afternoon, everyone. It's been a wonderful session, and thank you so much to IOS and the entire team who put together this session for calling me for this talk. I know we're short of time, so I will jump straight into it. So, definitely for everyone who's doing corneal transplants, the OCT is quite an invaluable tool, both for planning preoperatively and evaluating our patients postoperatively. And I'll just highlight a few case scenarios clinically where it's very important. So, straight out, I think preoperatively, the kind of decisions that it helps us with is the type of graft sometimes, so other than the clinical indication. Sometimes there are conditions in which we may have a choice of doing a penetrating versus a lamellar, and there knowing the depth of the lesion, the opacity may help us. It also helps to know the size and depth of the graft, and of course the technique of surgery. For example, whether you would like to do a big bubble or not, or a manual dissection when it comes to a lamellar, anterior lamellar keratoplasty. So the first decision which it helps us with is a full thickness versus lamellar. So as you can see, these are multiple different conditions. In the left-hand side, we have a healed heel scar. In this, we may or may not go for a surgery, but if in case it was a very dense scar in the central, we would like to know whether it is going till the DM is involved, and in that case, you would need to do a full thickness surgery. Hydrops is a condition again where in the initial stage we would manage it, see the break, and decide how to manage, and then later on plan for whatever transplant if required, if it cannot be managed with conservative. And in advanced keratoconus, again, when there's a lot of scarring, we'd like to see how deep that scar is, whether it's involving the DM endothelium, and otherwise we would always try to manage with a lamellar keratoplasty. So it's extremely useful and very intuitive to look at that OCT and check and as far as possible remove only what is required. Another very useful tool on the OCT is the calipers. We just need to go to the image and select it. There is an option for choosing the calipers on the side, and you can manually measure where you want to place them and the extent to be measured, whether from the epithelium or within the stroma. And you can get a very good assessment on how deep the opacity or lesion is. One word of caution, of course, is that it has a slight, because you have to do it manually, there is a slight variation from person to person, so you have to be quite careful, but you can get a very good assessment nevertheless. And this helps us then decide on the size or depth of the graft based on the depth of the lesion. So that's quite useful. Another tool which is very useful. Another thing with the OCT is that sometimes subtle changes could be picked up on the OCT. For example, the case in the center is a post-hydrops. But if you see that the area of the scarring is not the same as the area of the thinning. So when we are doing the surgery, we might have to keep that in mind so that we don't have any intraoperative complications. And it does help to sort of plan your surgery in advance. So these subtle changes are very easily picked up on the OCT. One point which I'd like to highlight in addition would be that other than looking at a single image, it's better to go to the machine, scroll so that the cursor moves all around, look at all the angles, because sometimes there may be a particular lesion or opacity or a finding which is restricted to a certain section. This is another point which I find is very useful for the OCT, especially when dealing with advanced keratoconus where there may be a scar. So if you see this patient on the pentacam, it shows that the pachymetry is around thinnest going down to only 360. But when we look at the anterior segment OCT, we find that it is much lower than that. And this would be clinically apparent as well, but it's a good idea to measure it, because if then we're looking at what is the guarded depth knife that you need to use or what kind of dissection you'd plan to do. So in addition to the scarring there, which is then morphing what we're seeing on the pentacam, it's very useful to measure it with these calipers. Another important feature that the OCT gives us, and depending on the type of OCT, then you would see the various structures, so whether it's still the angle, anterior capsule, or posterior lens capsule. But definitely all the OCTs give you enough of the anterior chamber and the angle information. So areas of peripheral anterior synechiae, irregularity of the anterior chamber, and this is very useful, especially in endothelial keratoplasties, to know what is the area of manipulation that is available to us. In this case, you can see that in addition to the corneal scar, there's also an extensive PAS formation. So we would need to know how to manipulate or where to avoid or need some additional procedures. This is a patient whom we saw that had a previous surgery done. It's obviously a decompensated cornea, and if you look closely, you can see the anterior chamber IOL there. So what we'd like to know, in addition to the corneal findings, is how the IOL is placed and whether it's impinging on the angle on the cornea. And in the OCT, you can very clearly see the haptic of the IOL sitting in the angle, and this side it's got involved in the iris, and there's a lot of synechiae formation which is going on to the cornea. So you'd also like to see, sometimes there may be a haptic of a posterior chamber IOL, which has also come into the AC through a PI. I've seen that as well. So these are features which are also very, very well picked up on the OCT. The good thing is to go and check it in all angles and all directions. Coming to the intraoperative findings that we can see, there's a lot of work which has been done from AIIMS and a lot of publications from it. They're very useful, especially intraoperatively, to pick up the depth of a bubble or to see the apposition of the graft. And especially, I'm sure in the learning phase, it may be quite useful, and of course, as a research tool as well. So it helps in our decision making, pick up complications early and manage them early. In the postoperative, right from the assessment of the graft-host junction, whether it is the anterior or posterior graft-host junction, the OCT picks it up beautifully, and you can see the apposition and the anatomical changes which are there. And it's important to look at both the anterior and posterior graft-host junction. So in this next image, you can see that in it, even though the anterior graft-host junction looks quite pristine, there is that small change on the posterior graft-host junction, and depending on how large or what is the extent of it, it would change our clinical judgment. It could be much larger. For example, this is an early post-op in which there was a huge mismatch between the anterior and posterior graft-host junction. And here you will have to follow this patient closely or take it up to do something because this overhanging edge could add to complications in the post-operative period. When we're talking of endothelial keratoplasties, of course, the graft-host interface also is extremely important, and most of the time you'll get a well-attached graft, but in some cases you may see a small area of dehiscence or a mismatch or an area which is not well attached, and these more subtle changes can be picked up. In this image, you can also see that there may be something in the interface, some material there which is not allowing the graft-host junction and the interface to oppose well, but post-bubbling, and this is the bubble which you can see on the image, but post-bubbling, they usually attach well. Of course, if it's a very large amount of dehiscence, even the image, can look inverted, but it's good to be able to image them and record it, and then helps for our prognostication of this graft. Suture removal in these patients whom we do corneal transplants can also be done. Certain versions of the OCT also give us a topography, so you don't need a separate topography map there. You can look on the OCT itself and plan your suture removal based on where's the steep axis. So that's an additional point that the OCT helps us. I'm done. So the OCT is extremely useful. It helps in various aspects of decision making and planning. It definitely helps in our patients' progress, and clinical changes can be picked up quite easily. Accurate measurements help us augment our clinical judgment, and because of its various multifaceted use, it's a very useful tool in our armamentarium. Thank you very much for a patient list.